Why is Donald Trump the poster boy for ADHD?
So ADHD is a condition that's defined in terms of observable behaviors, such as blurting things out, interrupting others, um, trouble starting tasks that require concentration, trouble following up, hyperactivity, fidgeting, being unable to stand up when others are sitting, or being able to sit, not sitting down when others are, when you're expected to do so. So there's a host of 18 different symptoms that are used in the official diagnosis or definition of ADHD. You only need 5 of them as an adult. And he unequivocally, not just a matter of opinion, meets at least a dozen and probably 15 or 16 of them. And maybe more so during a first term, it was very frustrating to hear pundit after pundit say, he's blurting things out. He has chaos all around him. He doesn't follow up. He hasn't done his homework or prepared ahead of time. He doesn't read. He's fidgeting. He's a narcissist. And I'd say, wait a minute. None of those have anything to do with narcissism. This is textbook ADHD. This could be a teaching moment for us to learn more about ADHD. And yet we were sort of kept ignoring or focusing on facets of him that seemed more fascinating, or I don't know what. That's the rationale.
What can we learn from how Donald Trump behaves?
Well, part of it is that even though there are some individuals who get diagnosed with ADHD inappropriately, so there are cases of overdiagnosis, I won't contest that. My own clinical experience is that underdiagnosis is far more common, and particularly among adults, and particularly the older the adult. So anyone who's in their 70s, 80s, 90s grew up in a world where it wasn't even particularly recognized in children. But when I started my psychiatric career in the mid-90s, it wasn't accepted that ADHD could exist in adults. So anyone who was an adult by the time in the 90s, probably did not learn that they might have ADHD. And, many people have picked up on it since then, but I've seen dozens and dozens of people over the years, many who were in the mental health system for years, many who were on disability for years. And the doctors were wondering, well, why isn't this person's depression responding to treatment, or why isn't there anxiety? And it's because primarily they had ADHD and you didn't even see it because you didn't believe it was there. So in the era I grew up, the media was much less fragmented. You could have a pop star, you could have a football player, you could have some other character, a TV anchor, and most people would know if you just said, what does James Taylor act like, or something like that. Most people would have some idea. In this era of fragmented media, there's only a handful of individuals that, if you describe blurting things, if you describe Donald Trump's behavior, people say, oh, I see it, I get it, I understand it. So even I know that Taylor Swift exists. I don't know what she acts like. I don't, if someone described her behavior, and maybe that's, just me. But I think, I'd recognize a face, picture of her, but if you went on describing what she behaves like, I haven't seen that. That doesn't mean anything to me. So Donald Trump, because he is in front of us all the time, provides a vivid example. And my hope was it was be a pathway for people who would never pick up a book about mental health because they didn't think they had a condition. They could see it either in themselves, or they could see it in their family members or coworkers or others. And that's happened. I've gotten, messages, emails, and notes from people who, one of my favorites was an 80-year-old. He was a widower. He actually, the story is funny because he said he bought the book because he's interested in books written by MD PhDs, which in itself is kind of an ADHD, he's focusing on one aspect of it. And it wasn't until after he bought the book that he realized this was about Trump, a part, which again shows he's not paying attention to some details. But then when he read it, his whole life started to finally make sense to him. He had a successful job, but only because people around him sort of respected it. He was very smart, but he sort of went off in lots of unconventional directions and had his career stymied in some unfortunate ways because of his ADHD, but he also had some successes because of his ADHD. But his whole life hadn't made any sense to him. Why was it so irregular and wandering and nonlinear until he read the book? So that's part of the audience I was hoping to reach.
So for that audience, and you mentioned that that someone just needs to meet 5 symptoms out of 18 to be officially diagnosed with ADHD. What are the most common symptoms that people can maybe look out for in themselves?
So there have been factor analyses to look at which are the most sort of central to ADHD, which may or may not be exactly the most common, but fidgetiness among an adult, so not being able to sit still. I mean, it's one, lots of the hyperactivity measures overlap. So one of them is being unable to sit down or remain seated when others are sitting down, and another one is running around when you should be running around. You know, if you meet criteria for one of those, you're likely to meet it for the other. So there's a lot of so fidgetiness and inattentiveness, distractibility seem to be the core symptoms of ADHD. And what's one of the tricky things about ADHD is, even though we have objective measures that are based in behavior, these are all behaviors that everyone does at least to some amount of the time. So it's that you need to be doing those in excess for your own age group and your own cultural background and gender. So we don't expect, a 5-year-old in kindergarten or pre-kindergarten to sit for 3 hours, whereas we would an adult during a concert. So they have to be excessive for that person's age group, and they have to be causing either distress or dysfunction. And the symptoms have to start before the age of 12. So it can't just be, there's people who have long COVID. I mean, one of the commonest set of COVID, one of the most common disabling sets of post-COVID, long COVID symptoms is brain fog, trouble concentrating, trouble being distracted, so it's a host of ADHD symptoms, but officially, if you didn't have any symptoms before the age of 12, that doesn't give you an ADHD diagnosis. Or there's certainly some people would call that secondary ADHD.
So there can't be a trigger post 12 years old that triggers ADHD. It has to have.
Well, yeah, I mean, officially, you have to have the symptoms before 12. So the other, particularly before COVID, the other moderately common way that a clear environmental triggered it was head trauma. I have a patient who, she was a reporter in her 50s, had functioned well her whole life, and fell during an ice skating accident, had a significant concussion, and afterwards was distractible, wasn't meeting her deadlines, couldn't organize her notes, couldn't, she wasn't, having a huge memory deficit. It was all what we call the executive functions, how the brain organizes the information coming in and tries to come up with focused responses or actions to solve the problems that it's faced with in the world.
So one of the reasons I actually wanted to talk to you today was I've been looking into an ADHD diagnosis myself, and I'd never considered. I'm 30 years old now. I had never considered it until last year, essentially, mainly because I had this perhaps immature definition of what ADHD was. That I was thinking the kind of cliched examples of you can't sit still, you didn't do well in school, couldn't pay attention in school, and all the rest of those sorts of cliched symptoms, which I didn't have, or at least it wasn't obvious to me that I didn't have them, if that makes sense. There were some subjects that I did extremely well in, and there were other subjects that I just didn't. And so this comes down, I've heard you say the difference between an importance-driven brain and an interest-driven brain. And I think I was just very lucky to have
the interest in enough of your classes.
Exactly. Yes, exactly. So it never occurred to me. And so, like, one of the reasons I want to have this conversation is just for other people, maybe like me, who would never have even considered an ADHD diagnosis. Um, so yeah, that's just where I'm coming from here.
Yeah. So there's a lot of different angles to unpack on that. I mean, one thing, and this is hard to say without it sounding a little pejorative, but we know because of ADHD itself, your own ability to detect your ADHD is probably impaired. You know, if you're not paying attention, if you're distracted, and a silly example I come up is if let's say your biggest problem is you walk into the next room and you forgot what you're doing and you're not paying attention. You're actually doing that 20 times a day, but you're not paying attention. So you think it's only happening 5, 6 times a day. So that's one contributor to why people with ADHD might not be as aware of what their symptoms are. But then, as you highlighted, the difference between an importance-driven brain and an interest-driven brain. So most of us in our modern society know you have to pay your bills on time. You need to turn your homework in on time. You need to get the report written so you get your expense account paid or whatever it is. And the people with ADHD, it's not that they're ignoring that. It's not that they don't know that that's the case. It's that, yeah, I have to do that, but that's too much time, too much effort. And hey, it's way cooler to watch this football game, or see what my favorite or my least favorite politician's blurting out, or watch these cat videos for 2 hours.
Mm. And one of the other things I heard you say that helped me with defining what ADHD is, and perhaps kind of got rid of those sorts of cliche definitions I had in my head, was that ADHD isn't it's a what am I trying to say here? It's an inability to focus attention rather than an inability to focus. Is that right?
Yeah. So I mean, the title itself is a pretty lousy one because it's saying you have a attention deficit hyperactivity disorder. So it's saying that you have a deficit in attention. And we know pretty much everyone with ADHD can pay attention if it's an interesting enough, compelling enough item. And often hyperfocus, getting too pulled into it, so it's useful to think of attention as having at least, and there's different ways to examine or look at attention, but for attention, it's important to be able to direct it in the right way. So, if you're giving a talk, you don't want to be distracted by the heckler in the audience or the airplane flying by outside. So it's directing focus. 2, then it's maintaining focus. If you're on a task, you want to stay on that task till the task is done, and not being pulled off it again by distractions. And then 3, it's switching when it's appropriate to switch to something else. Because again, people with ADHD might be coding something at work or doing something and everyone else has left the building, and it's the janitor sweeping up at the end of the day who's wondering, where did everyone go? It's because they got so focused and didn't appropriately shift their attention away from the task at hand.
It's almost like it's such like a paradox that on one end, someone with ADHD can focus so intently on something on one side, and then on the other side, it's almost impossible, just dependent on the context.
Yep. Yeah, so it's control of attention rather than attention per se.
Yeah.
Not that they don't have attention or ability to pay attention. It's less ability to control where it's being directed.
Are there any other society-wide misconceptions that we have surrounding ADHD?
I mean, there's probably dozens, and by I say that, there have been several studies that this is a popular topic to talk about on TikTok, and several different surveys over the last 5 years have looked at the content of material on TikTok by influencers who are talking about ADHD. And in every study, the majority, and sometimes as high as 70+%, had misinformation about ADHD there. So there's lots of common misunderstandings. What are some of my favorites or ones I see most often? I mean, one is one talking about we know that there's a clear, strong genetic contributor to ADHD. And the ADHD community, and that this is both patients and researchers to some extent, has been sort of for years somewhat defensive about ADHD. Because again, if you have schizophrenia and you're talking, you're hearing voices or you're seeing hallucinations, that's clearly outside of normal. Most people are not doing that, certainly on a regular basis. It's easy to identify, yes, this is clearly different. Yes, this is clearly problematic. And with ADHD, again, all the symptoms are things that quote, normal people are doing at least some of the time. So again, it's the degree to or extent. And that made many people still question, this doesn't really exist. This is really, we're pathologizing part of the normal range of human conditions. And partly in response to that, some segments of both the patient community and the research community have sort of clung to, we have literally tens of thousands of studies showing that there is, genetic influence, that there are group averages and certain neurochemical and maybe neuroanatomic differences. And that's led to the ADHD is a pure biological condition and it can't be influenced at all by the world around us. And that's clearly not, that's not what the genetic studies show. The genetic studies suggest heritability of about 70 or 80%, which means, again, a small but considerable role for the environment. And sort of the example of this in the popular mind, when the COVID pandemic started in the US, there were lots of pundits in the mental health community who said, we're going to see more alcoholism, we're going to see more depression, we're going to see more anxiety, we're going to see more other substance abuse, we're going to see more domestic violence. None of them that I heard, and I was tuned in fairly well, mentioned we're going to see more ADHD. And it's like, no, we're not going to see ADHD. That's a biological condition. But on the other hand, getting back to, we've known for decades, again, that there is an environmental component. And actually, when people come to treatment, it's usually at least partly due to environmental factors. So the kid who is really bright and could sail through middle school and high school might have more homework and might have less structure and might be greater expectations to perform on their own and might get shown up. Or kid might do well enough to get into a good university and ADHD hadn't been detected. But then again, in university, the same decrease in structure and increased demands make the symptoms more problematic. And sort of two other big transition points are, and particularly in this day and age, lots of universities are aware of ADHD and have services or accommodations is the word we use. I don't particularly like that word, but I like the word efficiencies, and we can get into that. But so there are people with ADHD who, with some sorts of assistance or structure, can get through college okay, but then in the workplace isn't going to make the same accommodations. So we've known that ADHD often shows up when the environment is either less supportive or structured or more demanding. And I'll jump to the last place that's the most surprising one is retirement. There's some people who find a job that is a good match for their talent and interests, and they go with it. And they know what's expected of them. Their coworkers or boss or managers know what's expected of them. It works well for them. And then there's a structure, there's a plan, there's a guidance system. And then when they retire, it's like, what do I do with my time? What am I supposed to be doing? I mean, some find volunteer activity or harassing the spouse or something else to their time. I'm being a little flippant there. But others, and again, particularly people who grew up in an era where nobody recognized ADHD, it's not unusual at retirement to suddenly discover, this is probably a lifelong factor, but it just wasn't problematic enough till now.
So speaking about the genetic component, I've heard various theories that say that what's genetic or heritable is a sensitivity to ADHD, and something has to trigger it environmentally, or something like stress, external stress, or something in the family. Something has to trigger it. Is there any truth to that, or is that, yeah?
I mean, when we give the numbers of heritability, that's sort of at a population level how important the genetics are, and it doesn't say. I mean, for any specific individual, we're not in a place where we can say, who you are is because of the genes you have, and has nothing to do with the environment. So a couple things. In the 70s, 80s, 90s, there was hope that we would find a dopamine transporter gene. I mean, so we know that dopamine is heavily involved in ADHD. Most of our drugs are in some way or another boosting dopamine and or norepinephrine. So there's hope that some dopamine receptor or dopamine transporter molecule would be deeply implicated. And there was some excitement that there are a few family lines where there is one variation of a dopamine gene that seems strongly associated with it. But when they went and looked at the whole population of people with ADHD, this only represented a small fraction of those with ADHD. So it's not that there's one simple gene. And for many people, or most people, it's probably what we call polygenic influence, which means hundreds, if not maybe even 1,000 different genes are each contributing a tiny, tiny little bit. And we know if you have a certain collection of variants of different genes, you may be somewhat, you may be 3 or 4 times more likely than the group of people who have let's just call them the non-ADHD variants of all these genes. But even in the high-risk group, there's a lot of people who don't develop ADHD, and even in the low-risk group. So the genes predispose or make one more susceptible, but usually, each brain is unfolding in a specific environment.
Mm. And so how effective a treatment is stimulants for ADHD? Is that basically the most effective treatment we have?
Yes, we have 60 years of data, and nothing else has come particularly close. That doesn't mean we won't get, and I mean, often the numbers are quoted as sort of somewhere between 2/3 to 3/4 of people respond to stimulants. But the number who respond is actually higher than that. Some of the people who do get a good response also have side effects that don't make them tolerable or sustainable, or they don't want to deal with the risks. And there are risks to those medications.
What are the main risks that people should watch out for?
So I'll back up a little. So by stimulants, the term itself is poorly defined. And there's sort of 2 different definitions. So one definition is anything that activates or looks like it's activating the sympathetic nervous system, the fight or flight system, which is actually primarily a norepinephrine system. So when you're feeling revved up, when you're anxious, you are better able to focus at the danger at hand, your heart rate goes up, there's other factors. So the broad definition of stimulant is that anything that looks like it activates the sympathetic nervous system. So that would include things like caffeine, and nicotine is also a stimulant in some ways. I mean, it would include amphetamine, it would include cocaine and methamphetamine, but many decongestants are also stimulants in this broad sense of the term stimulant. Many of our antidepressants are stimulants in this broad sense. But within the ADHD field, we tend to choose a narrower definition. And that's essentially the drugs that are amphetamine-based, or which are Adderall and Vyvanse or Elvance in the United Kingdom, and the methylphenidate Ritalin Concerta drugs, which are on a related molecule. I think methylphenidate Ritalin is sort of halfway between a full stimulant. So these drugs block the reuptake of norepinephrine and dopamine, so they make more of it available at the receptor synapse. But amphetamine particularly also increases the amount of dopamine and norepinephrine that gets released. So it really is boosting things to a greater extent. Whether methylphenidate Ritalin does that as well, as different studies and different neurochemists have somewhat different answers on that. So getting back to side effects. So the most common set of side effects are from I'll say the narrowly defined or strong stimulant definition. The most common side effects are feeling too revved up. So it can be too anxious, too jittery. It can be excessive sweating. It can be heart palpitations. It can be more trouble falling asleep. It can be decreased appetite. Most of those are dependent on the dose, and the higher the dose, the more likely. And most of them, if you go slowly enough or start low enough, most people don't have an issue with them. It can also increase blood pressure and heart rate, but on a group average, those are pretty small. So it's 5-point average or less on blood pressure. So that would mean very few people who are sitting right at the edge of hypertension have a problem with these. But in addition to the common sort of mundane and usually adaptable side effects, there are some much less common but serious side effects with the stimulants. So one is the potential for addiction. So most of our antidepressants, you might develop dependence on them. You might fall back into depression if you stop using them. Or an antipsychotic, you might fall back into psychosis, but you're not physically dependent and you're not craving the substance. And the studies are pretty imprecise or poor, but it's probably on the order of 1% to 3% of people on amphetamine drugs, medications start craving it and start abusing it over time. So that's one serious problem, and that can lead to even death at the extreme. There are also, much rarer than that, some people with underlying genetic heart conditions. So these drugs can trigger a fatal heart attack, but that is so rare and so clearly tied to a very small number of genetic conditions that if you haven't had episodes of suddenly becoming dizzy or lightheaded or passing out, or other family members had it, even the cardiologists who would stand to make a lot of money by getting everyone to get an EKG before they started these medications, the cardiologists say a good thorough history is enough to rule out that likelihood because it's so rare. And then this side effect that's uncommon, but I think gets neglected the most, and there's a little more attention in the last decade than there was in the 20 years before that, is amphetamine-induced psychosis. And that's where the drugs, and it can be fairly quickly in the first days or weeks of starting it, or it can develop after years of taking it, but where someone becomes floridly delusional, so out of touch with reality, and usually sort of paranoid symptoms of thinking people are listening in on what's going on in their thoughts, or are listening through the walls, or are out to harm them in some ways. And the really scary thing to me about that is that studies, and again, it's not extensively studied. So one is that happens with amphetamine products, probably around 1 out of 500, 1 out of 600 people. That's not terribly rare for something that serious. And the studies are small, but a couple of different studies have suggested that if you have a single episode like that, or people in their first episode like that, something like 15 to 20% of them, if you check on them 10, 15 years later, are in a chronic schizophrenic-like state. So in the US, there's been a lot of attention as we've been legalizing marijuana in the last decade of marijuana-induced psychosis. That's actually been partly why some people are finally looking a little more rigorously at amphetamine-induced psychosis. So they're trying to compare, what are the risks of this bad state, really bad state.
So I think some people might be a bit surprised to hear that the treatment for ADHD is amphetamines, or that people with ADHD respond well to stimulants like caffeine. I feel like some people might think, well, if your brain's always switched on and going all over the place, how can something that's do you know what I mean?
Yeah. So, one of the old explanations, which is that people with ADHD's brains are wired backwards or differently, and that's why they respond differently. And I'll answer the question, but I'll jump first. One of the most, to me, shocking groups of people, and it certainly isn't all of them, is how many pharmacists are completely clueless about it. So they see someone come in with ADHD who's, forgot to bring their wallet and, are trying to check out and are scattered and are jumping from topic to topic and maybe talking a little faster or louder than normal. And the pharmacists see, oh my God, this looks like someone hopped up on stimulant, street stimulants, cocaine or meth or crack, and I don't want to give them prescription medications that are doing the same thing. And getting back to Donald Trump, it's the same story there. There have been anecdotal reports, and I don't know the validity of them, that he was snorting Adderall on the sets of The Apprentice. And so again, I don't have direct evidence of that. But the claim was, well, that explains all this behavior of why he's distracted, why he bounces around from topic to topic, why there's chaos all around him. And Donald Trump's a good example. If you look, so one of the things that stimulants do is they dilate pupils. There's not a lot of dim light conditions can do that, but then they're constant when you're in the constant light. Excitement can dilate your pupils, but that's usually on the order of a few seconds. So there's a few State of the Union speeches, some other important speeches where Donald Trump is absolutely unequivocally using a stimulant medication. And the way I can say that is that his pupils are clearly dilated massively compared to him in other settings that week, dilated compared to other people sharing a stage or under the same lighting conditions. And simultaneously with his dilated pupils, his gestures, his body movements, his fidgeting is cut to a third of his baseline. So I looked at videos and I actually measured. And simultaneously, I used a measure of coherence, and this is a little squishier, more subjective, but just does one sentence have any connection to the preceding one? Not whether it's true or not, not whether it's insane or not, but just does it flow from it? So his coherence goes up, his ability to not be hyperactive goes up simultaneously when his pupils are dilated. There's only one. So, and this is a little inappropriate, but I said that rather than riffing on his sniffing, we should be supporting his snorting. He's more functional and more like a president or an adult when he's using it. And I am not condoning snorting stimulants, because that's not the best way to deliver the ADHD benefits. So getting back to the question, why do they help? The simple answer is that in terms of attentiveness or focus, even if you didn't have ADHD, if you're taking a test or an exam, if you're completely blasé and not hyped up a little bit, you're probably not going to do well. If you're too focused and too agitated, too revved up, you're probably not going to do well. There's a sweet spot. And I'm forgetting, there's a fancy term in psychologist name from the people who discovered sort of this attention. There's a sweet spot for attention. And what the drugs do is that they push people further along that spectrum. So the people with ADHD who have trouble getting into that sweet spot are in the sweet spot where they have more control of their attention. But even someone with ADHD, if you go high enough on the dose, first they'll get less scattered and then they'll become more revved up or scattered again. So it's getting the right dose for the right person.
Mm-hmm. I heard Gabor Mate made an analogy to what amphetamines do for someone with ADHD. And he says, imagine a police officer at a cross junction and they're directing traffic and the police officer falls asleep. The amphetamine wakes the police officer up and is ready to kind of direct traffic, to direct attention. And I'm not sure what part of the brain the police officer is in that analogy, but I've found that quite useful.
Yeah, and including the hyperactivity. So the little kid in the kindergarten room is looking at the plane going outside the window and looking at the other kid who has bright red blocks, and they're scattered, they're walking around. But if they're able to focus on the task at hand, then their hyperactivity reduces because they're not, their energy is directed in a useful, productive way.
Mm. Speak about children then. How can schools better handle children with ADHD?
One is, I think, better recognition is a starting place. And I mean, one is, I mean, the claim is that so many schools are overdiagnosing it and pushing parents to get their kids on medication so they're more manageable. And maybe I'm affected by an example. So my kids are just finished college, so they're in their early 20s. But when they were in second grade, I was chaperoning a class trip, and this was a teacher who was very experienced, teaching more than 20 years, a smart woman. And there was one kid in the class who, when he ate at the breakfast or lunch table, you could see where he had eaten because there was this cloud of crumbs all around him in the room. So this was a ski trip in the room. Literally 10 minutes after I helped him clean up the room and he had to take a shower, then I came back to see how he was doing, and there were 9 items of clothing. There was a sock on the radiator. There was, if you're doing like a set for a play or a movie, you couldn't have more randomly. And I could see exactly, he went to his backpack and said, is this clean or dirty? I don't know. And he would drop that because he saw his Pokemon cards. And so robust ADHD symptoms. And at the end of this 3-day trip, the teacher said to me, could this kid have ADHD? But she didn't think he could, because even though he's distractible in all of his other subjects, in math, he was so focused and attentive. And I said, that's exactly the pattern we see in ADHD. So there's still not as much awareness even among school teachers as I think they should have as to what really ADHD is or isn't. So what else can they do? I mean, one is, particularly in America, there's been a big trend towards, when we cut education, we cut physical education, we cut arts and interesting things, we cut the things that, exercise helps everyone. It's bizarre that the Secretary of, I guess not defense anymore, Secretary of War is so upset about people being fat, and yet we've cut, approaches that would keep kids more active. So, recess playtime is good. Understanding that neurodiversity, that different people work different ways and solve problems different ways, and what else would be? Probably having more frequent breaks depending on the kid's age, so they have time to get out the wiggles. A couple studies in the US have found that kids who are at the younger age, so usually, kids, there's a cutoff for birthdays, but that means some kids are almost a year younger than the other kids in the class. And several studies have found that the youngest kids in the class are more likely to be diagnosed, probably falsely, with ADHD. So there's a lot of aspects, particularly as kids are growing up, where ADHD looks like immaturity. They're not as developed or focused in their executive functions as kids their age. But if you are younger, then you're going to look more like. So there's simple things like that more schools need to be aware of and not be premature in slotting people into conditions that may or may not fit.
And in terms of who ADHD affects more, does it affect boys more or girls?
So historically, 20, 30 years ago, we were getting twice as many diagnoses in boys as in girls. And most studies still find it slightly higher in boys than in girls. Some people argue that the rates are exactly the same and we're still missing it more often. So we haven't talked about this angle much. So I've been sort of talking about ADHD as one monolithic thing, but we do divide it into 3 types. We divide it into a inattentive type, where the person's symptoms are purely in that inattentive realm. There's a combined type where they have both inattentive and hyperactive impulsive symptoms. And then there is a pure hyperactive impulsive type, but that's pretty darn uncommon. So most people are probably in a combined type. And there is some evidence that women may be overrepresented among purely inattentive types, and that because of this, I mean, particularly in a school classroom, if a kid's, looking out the window and distracted but not causing commotion versus the kid who's literally racing around with scissors and bumping into kids, which is a problem from classroom disruptive? It's the hyperactive one. So those are the kids that are more likely to be identified by the schools and told that they need treatment. So there may be some bias that way. And then there's a separate factor that, at least as of now in America and probably most of the West, that there's still more pressure on girls to behave and to be ladylike and to not. So there's probably more, and it's not even necessarily conscious, but suppression or masking or trying to hide their symptoms so they pass. And these are gross generalizations, but more women are more concerned about whether they're going to be accepted by their peers than guys are in general. So how much of the differences are innate sort of in the behavior, different patterns or types of ADHD, and how much is in suppressing or hiding symptoms? To me, that there probably is at least somewhat of a real biological bias. So there are some studies looking, for example, at twin pairs. So if you are a boy-girl twin pair, then in utero, that girl is exposed to higher levels of testosterone than a girl-girl twin is. So she's getting some testosterone exposure. So there's a few studies done on that way and a few other ways that do suggest higher levels of testosterone during pregnancy. Exposure to the fetus may be a factor or a contributor when we talked about, in addition to genetics, what else are the factors? So that appears to be one small factor. And clearly, all boys don't develop ADHD and all girls aren't free of it. But that's one thing that can push, given your genetics, you a little further in that direction.
And statistically, I've read that people with ADHD are more likely to become addicted to just anything, really. More likely to be incarcerated, more likely to commit suicide or take their own life, I should say. Why is that? Is it just a case of impulsivity, or is there more to it?
Yeah, well, I'll start with suicidality, because what's so disappointing is that the suicidologists sort of still call or view suicide as deaths of despair. And certainly some cases or many cases are. But there have been numerous studies in the last few years, but we know that the rate of suicide if you have ADHD is higher than it is with panic attack, higher than it is with a bunch of other conditions which are considered risk factors for suicide. And the suicidologists don't usually include ADHD in their samples as a risk factor. So we know if you are diagnosed in childhood with ADHD, on average, and there's only a few studies looking at this, but your life expectancy is probably shortened by somewhere in the 8-9 year range. That's as big a factor as if you got full-blown major depression. It's as big a factor as if you're diagnosed with diabetes as an adult. So that's 8-9 years is a lot of lost life. And the breakdown is almost half of that excess lost life is accidents, and the other half is suicide. And so it highlights that a big part of suicide is impulsivity. People there might be some despair in the moment, but it's that they're acting on that despair when they have less ability to take a step back and realize an hour from now, 2 hours from now. And that's part of why the gun control discussion in America is so focused on the murder rate. But we're killing substantially more people with suicide by guns. And there's good data from other countries in the world that when you make guns less immediately accessible, you have lower rates of suicide.
Yeah. And it's also just thinking about, say, the prison population. If the prison population is over, if there's far more people with ADHD in prison, whatever you think about how we're punishing people, it is essentially torture for someone with ADHD to be put into a room for 23 hours a day in some cases, and then they're only getting out for an hour. That sounds horrific.
And in most prisons, even if someone came in with a clear diagnosis and was on stimulant medication, they won't allow that in the prison because that's contraband. And yet, and I think it was actually out of Britain, there's at least a few studies indicating that if you really want a better behaved prison population, you should continue treating the people with ADHD, because those are the people who are causing problems, not intentionally. So separate from the reasons of why they got in or why they got caught, it's, if you're the one supposedly marching to the lunch line and you're distracted by something, or you blurt something out to the guy next to you because you have ADHD and it's harder not to. That's a disruption. That's, the authority figures view it as that's rebelliousness, that's defying our authoritarian system, but it's often not, overtly consciously planned subversion. It's just, this is how these people's brains work, and if they were on their regular medicine, there'd be fewer problems.
One of the things that I found very surprising, you can tell me or not if this is true, it's just something I read, that people with ADHD are more likely to have allergies, eczema, asthma, these sorts of kind of physical conditions. Is that
so a whole bunch of autoimmune conditions are associated or found in higher rates. I mean, it's not that, again, everyone with ADHD has them, but it's probably, depending on which condition, twice the background rate of the general population. So with not just ADHD, but with other mental health conditions as well, we often see signs of brain inflammation. And there have been correlations, at least, between brain inflammation and ADHD. So whether that's, again, one of the other factors, like, high testosterone levels, that some specific type of antibody may push, again, a brain that's prone or in an ADHD direction. Or it could be almost coming the other way, that, some brain differences in ADHD may make it harder to control or regulate parts of the immune system. I mean, we've learned a lot about the immune system, and we've learned a lot about the brain, but we're still sort of at baby steps in terms of the interactions between the two.
And I want to, for the kind of last part of our conversation, I want to kind of focus on treatments and things people can do to kind of relieve symptoms. So what role does scheduling play for someone with ADHD? How does that help?
Scheduling's huge. I'll jump to lifestyle things first.
Okay.
In terms of my experience, and I think there's a lot of data to back it up, is that sleep, I mean, we know there's genetic aspects of ADHD that make people more likely to be night owls. And so more productive at the end of the day, less, more out of it in the morning. Not absolutely everyone, but it's a high rate. And even with the best medications, what I tell people is that if you don't get your sleep organized, and so much in America, there's public service announcements been around for 80 years, get, close 7-8 hours of sleep a night, get 7 or 8 hours of sleep a night. But we've known for at least that long that it's not just the duration of sleep, it's the quality of sleep. And a major factor of quality of sleep is being consistent with your circadian rhythms, your internal clocks. So if you're used to sleeping close to, let's say, midnight to 8 a.m., but you stay up late on the weekend and you're out till 4 a.m. and you sleep till noon the next day, you still got your 8 hours. And almost everyone knows they're not restored the same way by those 8 hours. They're waking up at a time, when their brain thinks it's already the middle of the day. So getting regular and sufficient sleep is huge, and it's a challenge. Because again, if you have trouble resisting your impulses, there's less distractions, so you might be more productive at the end of the day, and it's hard to turn your brain off often if you have ADHD, separate from, again, just the circadian rhythm and other biases. So getting good sleep, I'd say, is probably the number one before I jump to scheduling. And actually, when I talk about scheduling, I actually say there's 4 things you should put on the schedule before you put anything else on. So again, most people, when they think schedule, they're thinking my schoolwork or my work tasks, the important thing, or the important shopping errands that they have. But I'd say before you put any of those goal-specific tasks on, you should make sure you know when you're sleeping, you have enough time and it's a regular time, that you know when you're eating. The only people, I have people I've had people who had eating disorders. I've had people work with people, who are on food restriction plans. But the only people that I hear say, oh my God, yesterday it was 4:00 and I realized I hadn't eaten all day. That's ding, 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 ding. That's probably someone with ADHD, because most people are more attentive to their bodies and more attentive to what's going on around them and more attentive to the clock. So having sleep, having meals, having some physical activity, because again, and that's a broad term. So, some vigorous activity, the American Health Association say about 150 minutes a week. So spread out during different days. But also, not just sitting in a chair for 6 hours at a time, which someone with ADHD, particularly if they're gaming or doing something that's interesting to them, can do. That we know is not particularly healthy. So you'd need physical breaks that give you physical activity. And then we all need, and we shouldn't be gearing towards being 100% productive 100% of the time. That's just not sustainable. We all need downtime, recovery time, and whether that includes meditation, whether that includes something fun, there's different ways to break it up. So I'd say and if you have that in your schedule, that makes it easier to work. If you know, okay, I can put in a half hour to do my Sudokus, or to work on the crossword, or to go for a walk and watch or listen to my podcast. It's easier to work if you know, okay, that's planned. I'm not going to be just sitting here grinding away all day with no chance of a break. So it helps with the recovery, and it helps with actually usually directing focus on the task. So scheduling, usually the biggest barrier to it for people with ADHD, and there's a form of talk therapy called cognitive behavioral therapy, which focuses on people's thoughts, feelings, and behaviors. And it was originally developed for depression, where we usually don't have direct access to changing our feelings, our emotions. But if you change what you're thinking, if you change what you're doing, the feelings will result in changing. Cognitive behavioral therapy was used for depression. It's used for different anxiety disorders, PTSD. And they tried for years to match it for ADHD, and it's a horrible fit, because a lot of what CBT is doing is asking you to pay close attention to what you're doing. And again, people with ADHD are distracted, and to do lots of really boring homework over and over and over again. So you're in training new patterns or habits. So it took a lot of sort of tweaking and adjusting to develop CBT, cognitive behavioral therapy programs for ADHD. But there have been a couple manualized formats for it. And interesting, the centerpiece for 2 teams that were working completely independently is having a scheduling system and a task list that's tied to your scheduling system. And when most people with ADHD hear scheduling, it's like, oh my God, and it's the analogy I keep using, is their view of a schedule is the taskmaster on a Roman galley, telling people with the whip, saying, you're going to do this activity at this time, and we need the schedule to force you to do it because it's something you don't want to do. That's not appealing to most people. And what I tell people is that's not what a schedule is about. A schedule is about helping you with your own values, your own goals, your own aims, line up what you're doing in the moment with that bigger picture. That's what a schedule. So rather than the whip and chains and telling someone to stroke faster, it's really the mother hen who's counting the chicks around her before she hunkers down and nestles and takes care of them. So it's the kindest, most benevolent part of you that's going to be your scheduler. Sometimes that helps, sometimes that's not enough. So again, once you have the big four, the sleep, activity, then it's slotting in the tasks you have to do for the day. And this is where I'm already getting from sort of scheduling into the task list. So with the task list, the recommendation is to sort the things you have to do into three big categories. One of the things that are really important and are really urgent. They need to happen today. Deadline for your assignment is today. If taxes need to be paid, if you have to move your car because it's going to be towed, that has to be done. The B group of items are the things that are important, but they're less urgent. And then the C are all the things that are not important and not urgent. And lots of times, people with ADHD, in their need to, I need to be doing something. I have so many things that are undone. I'll go buy a toothbrush because that's on my list. If it wasn't urgent or important, you feel, I've crossed that out. But then at the end of the day, you have new shoelaces or toothbrushes, and your car still didn't get moved, and it got towed because you didn't pay attention to it. So it's doing all the A's before you move on to any B's, and doing all the B's before you move on to any C's. And if the C's wait long enough, if it's 3 months and you still haven't replaced your toothbrush, that might move up in urgency because there aren't any bristles left on it. So the list changes with time, but it's finding then a time in the day, and usually it's assigning sort of blocks of time, and usually I encourage people to think of somewhere between a quarter of an hour to 2 hours at a time. And that's, there might be a task that really is 6 hours of work, but saying, I'm going to do it for 6 hours is unrealistic. You need to almost always chunk it into times that fit with whatever else you need to do during the day. And I've had people who tried to micromanage smaller increments of time, but then you're spending more time with the micromanagement. So
I was definitely the person that is whipping themselves into doing this massive to-do list that wasn't organized into priorities or anything like that. It was just a big massive to-do list. If I didn't get everything done, then I'd failed, or then I'd be rushing around the whole day trying to tick everything off. And as soon as I did that, as soon as I prioritized the list and scaled it right down to like what's one thing that has to get done, what's a few things that I should get done, and what's a few nice to have things. As soon as I'd done that, it drastically reduced the to-do list, and it meant when I finished those tasks, I could kind of stop and I could, give myself a break, which I think a lot of people struggle with.
Yeah, and having it as a list is also powerful because very often many people are moderately productive, at least during the day, but at the end of the day, what are you thinking about? You're thinking about all the things that haven't gotten done, that are unfinished, that are looming over you. So often our assessment of, am I really getting anything done is skewed because once it's done, I don't need to keep thinking about the toothbrush I already bought or that I moved the car. That's off the list. And an advantage of just having a list helps, you can review at the end of the day. Okay, I did do this, this, and this, and I need to focus more on higher priority or what it is, but it gives you a more balanced feedback than many people develop themselves.
Are there any non-prescription supplements that show kind of validity in helping with ADHD symptoms?
So I have a YouTube channel where I talk about medications and I talk about some of the substances, supplements. Most of the supplements that are potentially helpful have very limited research. So there's a couple big studies in children that suggested omega-3 fatty acids helped. There are also, though, a few studies of equal size before that didn't show any benefit. I think it's a reasonable one to try. Magnesium seems to be helpful, and there are some studies to back it up. There's some people who benefit from B vitamins. And then there's things like lion's mane, which are wildly popular in creatine, and virtually no rigorous research on ADHD or so So there may well be things that help, but I tend to be more cautious and say, read what's out there. If it sounds interesting to you and it's not likely to be toxic, then it might be reasonable to try. But a lot of these things might make sense, or there might be basic science research suggesting they might help. But there's lots of things that we know worked in rats or flies and didn't seem to work when it got to people.
What what advice would you have for someone who is struggling with rest, with stopping, when they've done all the tasks, they don't have to do anything else, and as soon as they stop, it's difficult. It's hard to kind of stop if it's watching TV or just just kind of sitting. What can people do?
I mean, one is using alarm system so you know when it's time to stop. And so it's sort of getting back to scheduling. And part of the scheduling, again, is realizing this is the best part of me, the kindest part of me that's setting this up. And I need to do things that are sustainable. So it's not just getting the tasks done if you burn yourself out. So part of it is sort of getting back to, okay, I've done enough for the day. One of the videos on my channel is also about perfectionism. I mean, it's often perfectionism that drives people to keep working, but even people who work prodigiously, even Thomas Edison and other inventors, still took some time off and took breaks because it's not sustainable otherwise. So part of it is often it requires thinking about what's actually enjoyable to do that's not work. And coming up with a list of things. Do I really enjoy it when I do take a walk around the block? Or do I, should I have a stack of crossword puzzles or Sudokus or cat videos or dog videos or whatever I like watching? Or, and it sounds silly, but, writing down what I can do or what I can do for fun or rest or break. And this verges sort of on meditation is clearly. There are studies looking at meditation being of value for people with ADHD. I mean, there are studies looking at value for our physical health and mental health otherwise, but specifically for ADHD, there's some evidence of helping with focus and attention. Lots of the standard, sit in a dark room and thinking about nothing is not a good entryway to meditation for many people with ADHD. So finding meditative pathways that are either somewhat physical, so yoga gives you some focus on you're doing something with your body, or breathing techniques, maybe an easier way to get into a meditative practice.
And what about partners of people with ADHD or friends of people with ADHD? Is there anything they can do? Is it just a simple case of knowing that they have it and being a bit more compassionate when?
Knowing and compassion are huge. And what I say is the exact same words, depending on how they're issued, can sound like either a nag or a reminder. There's a huge difference. And I urge couples to talk together and it's often, just a slight change in the specific words or sometimes just the tone of voice that, and acknowledging this person has difficulties with time management. That's a common ADHD feature. Is it important for us to get out the house so we get to dinner date on time or get to the concert or whatever? Usually if that's something you wanted to do, it makes sense to make that happen. And if this is just one assistance that the person requires, that's usually a better way to frame it than I need to nag them to get them out the door on time. But again, coming up with language that works for both people so that they can both hear it. This is a reminder. This is a reminder knowing this is how your brain works. My brain works this way. I'm going to be more helpful at keeping track of time.
What does the future of ADHD treatment look like? Is there anything there anything in the works? Is there any research being done for anything new?
So, yeah, so for decades, almost all the medications focused on drugs essentially that boosted dopamine and norepinephrine. So those are the stimulants, but also some of the old tricyclic antidepressants, things like Wellbutrin, bupropion. And then it's almost a decade ago now, we finally tapped into other ways of affecting some of those systems. So guanfacine, a blood pressure medicine, clearly is of help, even though it's not quickly helpful. So it's not primarily helpful because it does interact with the norepinephrine system. There's some exploration, although not terribly fruitful so far, with drugs that work on glutamate systems. So at an oversimplified level, glutamate's sort of working the opposite way of dopamine in the prefrontal cortex, where we think a lot of the ADHD circuitry is involved. And there was a study earlier this year on amlodipine, which is a different class of blood pressure medicine than guanfacine is, completely different class. But there was preliminary work in fish and rodents that it may be particularly helpful for ADHD. And there were some genetic and indirect, I'll say, human studies that, I mean, they were specifically looking for drugs that are already on the market, so it's easier to get them through the approval system. And we know that they're generally safe, that might help with ADHD. But that one doesn't yet have the simplest, most direct, let's give it to 100 people with ADHD and see if it helps. But we are finally branching out medications to other systems beyond just norepinephrine and dopamine. The other area that's changing, so for 50, 60 years, neurofeedback has been a huge market. And again, because the stimulants have a potential for addiction, have a potential for psychosis, they are sort of stronger drugs that lots of people are worried about. It makes sense that a non-drug approach is appealing to lots of people. And there have been a number of well-designed studies and a number of meta-analyses that have concluded, despite 50, 60 years now of doing this, the evidence is so incredibly poor and weak. That doesn't mean it doesn't work, but it means, particularly since these clinics are often seeing people once or twice a week for several $100s for months and months at a time, they can afford to do the research to show it works. They haven't yet. So there may be some recent advances in how neurofeedback is done. And there was a study, not in ADHD, but in actually methamphetamine addiction, where they had an individualized approach. So usually neurofeedback is getting people training people to change their brain waves, if it's an EEG-based approach, or some of them use functional MRI, but they're changing brain activity, and brain activity is converted to some picture or animated screen thing that you try to change how high the rocket's going or change the line going up and down. And when you're doing that, you are changing your brain activity with the hope that you're changing relevant brain activity. Anyway, this methamphetamine addiction study, rather than giving everyone the same treatment, actually had people, they individualized the treatment, so they were trying to change their own specific brain activity that was present when they were exposed to a cue for methamphetamine. This might be too detailed or too. So one thing they were doing was looking at the whole brain activity, and they found that this approach was much more helpful. I mean, we think we know where reward circuits are, we think we know different areas, and there's a kernel of truth in much of that. It's not just made up. But each of us is an individual, and probably your ADHD brain doesn't look identical to someone else's ADHD or depressed brain. And this study sort of implies that it's the whole brain activation pattern that's more relevant to treatment and more helpful to treatment. So I can go into more detail. So there's, on the US market and probably worldwide, more than a dozen different devices now that you can do at home, sort of neurofeedback. And I mean, most of them have some real scientists working on them, but there's dozens of do-it-yourself at home neurofeedback messages, or not messages, products, devices on them. And most of them actually have some basic neuroscience researchers working with them to develop it, but very little sort of clinical data showing how well they work or who they might work for. And interestingly, many of the products on the market are actually cutting exactly the wrong direction based on this methamphetamine study. So for broad appeal and use, they're measuring brain activity in one specific area of the brain rather than the whole brain. And they're trying to standardize it so that you can slap this device on anyone's head and it gives you recordings and feedback in the right area. But again, if it's really the whole brain that's more relevant or important, that might be going in a less productive direction. So there's a whole host of devices and different ways to activate the brain. Some are using infrared, some of them are using other ways or systems. So I think we're sort of seeing the early stages of waves where we may have powerful effective treatments. I mean, in the US, there is a trigeminal nerve stimulation device that was approved probably 5 years ago now for ADHD. So there are lots of ways to tap into the brain, and we're at the early days of sorting out what's really going to be helpful or effective for people with ADHD. What I would say is many people's views of these are still, drugs are bad because they have side effects, and these are all benign because they're working with brain activity. But if anything is strong enough to change brain activity in a positive way, it presumably is strong enough to change brain activity in a non-helpful way. So I haven't heard of reports or damage from any of these approaches, but I would not be blithely thinking, this is going to be completely free of side effects or risks.
Mm-hmm. There are no solutions, only trade-offs, as Thomas so well said.
Yeah.
And just to round this out, is there anything in the book that you've rarely been asked that you think is just as important? Or is there anything in this conversation that we haven't spoken about that is just as important or more important than what we've spoken about so far?
One angle, so my book I say is 3 halves, and I can do the math and know that there's really not 3 halves. But the book I said is it's an attempt to understand Trump through the lens of ADHD, because if you don't get that element of him, he doesn't make any sense. A narcissist wants to do things to make themselves look smart and, a stable genius. And again, separate from whether you like his opinions or not, he's so often shooting himself in the foot and not capitalizing on his successes and not doing his homework and doing all the others. So 1/3 of the book is understanding Trump with the ADHD. Probably more importantly, the second part of the book is, again, just using Trump as an exemplar so more people can become aware of ADHD. And then the third part of the book is how our whole world is moving in a more ADHD-like condition. And that I'm actually writing a book now that's based on the third part. But so much, and people focus on the immersion in the computer or tech world, cell phones, and measurably that's shortening our attention span, increasing our distractibility. But there's studies that, again, it's affecting a broader range of ADHD executive functions, and one we haven't talked about at all now. So much of the ADHD discussion is focused on cognition, performance in school or work, and we know that emotional regulation is an important executive function that at least 2/3 of people with ADHD have affected. Immersion in our computer worlds isn't just making people distracted and short attention spans. It is making them more impulsive and less emotionally regulated. So we're reproducing a whole host of executive function deficits or issues And it's not just the computerization. It's also where our sleep at a society-wide level is disrupted. Our diets are messed up. Our activity is lower. Our immersion in nature is lower. So there's a whole host. And if you think you're immune from all of this, all the people you're interacting with are still more, they're on their phone, they're on this or that. So there's no way you're avoiding all this, even if you're exercise, eating, doing everything right. So I think we need to be looking more at a societal level as to what we can do and whether we really want to be pushing all of our brains more in this direction or not.
Mm. And so where can people stay up to date with what you're doing? You mentioned you've got a new book. Is there a publication date for it yet?
It'll come out sometime next year. So I'm working with a mental health publishing company called New Harbinger that's in the San Francisco Bay Area. And the book's mostly written, but I'll be out next year. And my YouTube channel has more than 200 or 300 videos on different aspects of ADHD. That's free. They're from 15 to 20, 30 minutes long each. And I also write on the writing platform Medium.
Okay, I'll link all of those in the show notes if people want to check that out. But John, thank you so much for taking the time. It's very much appreciated. I found this extremely helpful, so I know lots of other people will as well.
I've enjoyed talking with you, and thanks for the opportunity.